Most people use these words like they mean the same thing. They don't. Mental health, mental illness. You've heard both terms thrown around constantly. Maybe you've even used them interchangeably. I need to work on my mental health. Do I have a mental illness? But here's what almost nobody tells you. These are two completely different things, and mixing them up isn't just confusing. It's actually stopping millions of people from getting the help they need and understanding what's really going on in their minds. Today, we're breaking down the difference once and for all. By the end of this video, you'll understand something that most people, including some professionals, get wrong. Let's get right into it. Section 1, the common confusion. Here's the confusion everyone falls into. Someone says, I'm really struggling with my mental health right now. You immediately think, oh, they have a mental illness. Or someone else says, I was diagnosed with depression, and you think they have bad mental health. Both of these assumptions wrong. Here's why this matters so much. When you mix up these terms, you create a dangerous binary thinking. Either you're mentally healthy or you have a mental illness. There's no in between. It's like saying you're either perfectly physically healthy or you have cancer. Nothing else exists. This binary thinking does two harmful things. First, it stops people from seeking help early. They think, well, I don't have a mental illness, so I'm fine. Meanwhile, their mental health is deteriorating. They wait until they're in crisis before doing anything. Second, it creates shame for people with diagnosed conditions. They hear mental illness and think it means they're broken, damaged, permanently flawed. It becomes their entire identity rather than one aspect of their health. The truth is much more nuanced. Mental health and mental illness are related, but they're not the same thing. And understanding the difference isn't just academic. It's life-changing. Think of it like this. Imagine someone asks you about your physical health. You might say, I'm pretty healthy overall, but I have asthma. The asthma is a specific condition, a physical illness. But your overall physical health is the bigger picture, how your entire body is functioning day to day. Mental health and mental illness work the same way, but nobody explained this to us. We've been using the wrong mental model this entire time, so let's fix that. Let's start with what mental health actually is. Section 2, what mental health really means. Mental health is not a diagnosis, it's a state. Just like physical health, everyone has mental health, every single person, all the time. Your mental health is your overall psychological and emotional well-being. It's how you think, feel, and cope with life. It's constantly changing, moving up and down a spectrum depending on what's happening in your life and how you're managing it. Here's the key insight most people miss. Mental health is a spectrum, not a binary. You're not either mentally healthy or not. You exist somewhere on a continuum that looks like this. On one end, you have flourishing or thriving. This is when you feel good most days, handle stress well, maintain relationships, find meaning and purpose, adapt to challenges. Your mental health is strong. In the middle, you have surviving or getting by. Some good days, some bad days. Stress feels manageable, but not easy. You're functioning, but it takes effort. Your mental health is okay, but could be better. On the other end, you have struggling or in crisis. Everything feels heavy. Daily tasks are overwhelming. You're barely keeping it together. Your mental health is poor and needs support. And here's what changes everything. You move along the spectrum constantly. Last year, you might have been thriving. Then you lost a job and you moved to struggling. Then you found support, developed coping strategies, and moved back to surviving, then eventually thriving again. This isn't weakness. This is being human. According to the World Health Organization, mental health is a state of well-being in which every individual realizes their potential, can cope with the normal stresses of life, can work productively, and is able to contribute to their community. Notice what's not in that definition. The word illness, the word disorder, the word diagnosis. Your mental health is about how you're doing overall, and just like your physical health, it needs maintenance, attention, and sometimes intervention. You can have good mental health even with a mental illness, and you can have poor mental health without any diagnosis. Let that sink in for a second. Now, let's talk about mental illness. Section 3, what mental illness actually is. Mental illness is a specific, diagnosable condition. This is where it gets medical. A mental illness is a health condition that involves changes in emotion, thinking, or behavior, or all three. It's associated with distress and problems functioning in social, work, or family activities. Mental illnesses are diagnosed conditions with specific criteria. They're in the DSM-5, the Diagnostic and Statistical Manual that mental health professionals use. Examples include depression, not just feeling sad, but major depressive disorder with specific symptoms lasting a specific time period. Anxiety disorders, generalized anxiety, panic disorder, social anxiety, specific phobias, bipolar disorder, extreme mood swings between manic highs and depressive lows, schizophrenia, a serious condition affecting how someone thinks, feels, and behaves, OCD, obsessive-compulsive disorder with intrusive thoughts and compulsive behaviors, PTSD, post-traumatic stress disorder following a traumatic event. These are medical conditions. They have diagnostic criteria. They often have genetic components. They involve changes in brain chemistry and structure. They can be treated with therapy, medication, or both. Here's the crucial distinction. Having a mental illness doesn't mean you always have poor mental health. Someone with depression who's in treatment, using coping strategies, and has support might actually have better mental health than someone with no diagnosis who's burnt out, isolated, and not taking care of themselves. Think about physical health again. Someone with diabetes who manages it well, takes medication, eats right, exercises, that person can have excellent physical health, despite having a physical illness. Same with mental health and mental illness. The numbers tell an important story. According to the National Institute of Mental Health, about 20% of adults in the US experience a mental illness in a given year. That's 1 in 5 people. But here's what they don't tell you. 100% of people have mental health that needs attention and care. 1 in 5 has a diagnosable condition. 5 out of 5 have mental health that fluctuates and needs support. This distinction, it changes everything about how we talk about mental health and who seeks help. Section 4, the spectrum explained. Let me show you how this actually works in real life. Imagine 3 people. Person A, no diagnosed mental illness, but they're working 80-hour weeks, never see friends, eat poorly, don't sleep, constantly stressed. Their mental health, poor. They're on the struggling end of the spectrum. Person B, diagnosed with generalized anxiety disorder, but they're in therapy, take medication, practice mindfulness, have a support system. Set boundaries, their mental health, actually pretty good. They're managing and often thriving. Person C, no diagnosis. Balanced life, good relationships, handles stress well, finds meaning in work, takes care of themselves. Mental health, excellent, flourishing. See how mental illness and mental health are separate things. Here's another way to think about it. Mental illness is like having a chronic condition. Mental health is like your fitness level. You can have asthma, chronic condition, but still be physically fit by managing it well, exercising, eating right. Or you can have no chronic conditions but be in terrible physical shape because you smoke, don't move, eat junk. Mental illness is the condition. Mental health is how well you're doing overall. And here's why this framework is so powerful. It removes shame. Having a mental illness doesn't mean you're mentally unhealthy as a person. It means you have a condition that needs management, just like diabetes or asthma. It expands who should care. You don't need a diagnosis to work on your mental health. Everyone should be thinking about their mental health, just like everyone should think about physical health. It creates hope. Having a diagnosis isn't a life sentence of poor mental health. With treatment and support, you can absolutely thrive. It normalizes struggling. You can have a rough month where your mental health dips without having a mental illness. It's okay to not be okay sometimes. Research backs this up. Studies show that people with mental illnesses who have strong social support, good coping strategies, and access to treatment report higher life satisfaction than people without diagnoses who lack these things. Mental illness is one factor, but mental health is the bigger picture of how you're doing. Section 5, everyone has mental health. This is the insight that should be taught in every school. Everyone has mental health, just like everyone has physical health. You don't question whether you have physical health, you just do. Some days it's better, some days it's worse. You take care of it by eating well, exercising, sleeping, seeing doctors when needed. Mental health is exactly the same. You have mental health whether you have a diagnosis or not. Whether you're thriving or struggling, whether you're in therapy or you've never talked to a professional, your mental health is always there, always shifting, always deserving of attention. Here's what this means practically. You don't need to be sick to work on your mental health. You don't need a diagnosis to see a therapist. You don't need to hit rock bottom before you invest in your well-being. You can go to therapy the same way you go to a gym, not because something's wrong, but because you want to maintain and improve your health. You can practice mental health skills, mindfulness, boundary setting, stress management, without having any diagnosed condition, just like you can exercise without having any physical illness. The World Health Organization puts it perfectly. Mental health is more than the absence of mental disorders. It is an integral component of health and well-being that underpins our individual and collective abilities. Make decisions, build relationships, and shape the world we live in. Read that again. Mental health isn't just not being sick. It's about well-being, growth, connection, functioning. Everyone deserves to work on their mental health. Everyone benefits from mental health support. This isn't just for people with diagnoses. This is for everyone. And when we understand this, we stop gatekeeping mental health care. We stop telling people they're not sick enough to get help. We normalize conversations about mental health the same way we talk about going to the gym or eating vegetables. Section 6, breaking stigma and normalizing conversations. So how do we change the conversation? First, stop using mental health when you mean mental illness. Be specific. Say, I have anxiety, not I have mental health issues. Say, I'm working on my mental health, not I have mental health problems. Second, talk about mental health the way you talk about physical health. It's not taboo, it's not shameful, it's human. Third, remember that everyone you meet is managing their mental health. Some are flourishing, some are struggling, most are somewhere in between, and that's okay. Fourth, seek support early. Don't wait for a diagnosis. If your mental health is slipping, reach out. Therapy, support groups, trusted friends, hotlines, whatever helps. Mental health is health, period. Everyone has it. Everyone deserves support for it. Understanding the difference between mental health and mental illness. That's not just terminology. That's the key to destigmatizing mental health, helping more people get support, and creating a world where we talk about our minds as openly as we talk about our bodies. If this video changed how you think about mental health, leave a comment below, and subscribe for more content that makes psychology accessible. Thanks for watching. See you next time.